Okay, and now let's move on to everybody's favorite, sarcasm, connective tissue. So when we're looking at connective tissue, one of the main things you're going to notice is that it is avascular. That's definitely a huge part of it. So we're going to look at that and also look at a few tips and tricks of the trade so that you can better identify this. So the first one we will look at is areolar connective tissue. Areolar connective tissue falls in the camp of loose connective tissue. So when you're thinking about loose connective tissue, look at all of this white space in the background. You see all this white space, how the fibers are very, very spread out? Just that alone lets you know that this is loose. Where you would expect to find this, you would find this underneath the epithelium. And that area is called the lamina propria. So you have the lamina propria, this layer under in a mucous membranes, and also this is very good packing material around organs, and also surrounding blood vessels. So this is areolar connective tissue, and it is under the category of loose connective tissue because of all the space, all the white space, it lets you know that it's loose. And when we get to dense, you will definitely see the difference. Okay, this one I want to skip over. There we go, adipose. So here's adipose, which is fat. This also falls in the camp of loose connective tissue. Adipose, again, is fat. One of the telltale signs of looking at fat is these giant white circles, almost like it looks porous. And that's because there are hardly any organelles inside of fat cells. Why does it need organelles? It's just there for insulation and energy. It's not really doing work per se, so it doesn't really have a lot of organelles. So you'll see, the nucleus. See all the nuclei here, these dark spots that I'm pointing at? But you see this almost Swiss cheese, very porous appearance, the telltale sign of adipose tissue. And we know that this is loose as well because look at all of that white space, okay? And we'll move on. Here's adipose tissue again. So you see here, you can see the nuclei, but look at all of these big open spaces. And there's something in there, fat's in there. It's just that this is how it shows up on the slide. So when you see this appearance, this is definitely adipose. Here is reticular connective tissue. Reticular connective tissue, and we're going to look at that in different magnifications. Reticular connective tissue also falls in the camp of loose connective tissue. And this is what it looks like at 40. And here we are looking at the spleen, we're looking at a lymph node, I apologize. So here, this is the medulla, and over here is cortex. So let's bump up the magnification. There's reticular. This is the picture that most of you are probably used to seeing here. This is one of the more common appearances of reticular. But if you're in your lab looking through a microscope at 40 times magnification, this is what you're going to see. And over here, we have dense, regular connective tissue. And this over here is skeletal muscle over here, and then over here, this is the dense, regular connective tissue. That's the tendon right there. So let's bump up that magnification so we can get a better look. So, do you see how this has a very tight, wavy pattern? Do we see that? That very, very tight, wavy pattern? And up close, you can see that looks nothing like skeletal muscle over here, right? This is striated muscle. You see there's a banding pattern. Over here, you just see these waves, okay? So this is definitely not loose because I don't see a lot of white space. It's very, very tightly packaged together. So that is dense, regular connective tissue. And so that, as far as dense, regular connective tissue, we expect to see that in tendons, in ligaments, and also aponeuroses. And aponeuroses, you have two main ones that you'll probably cover. Probably the aponeuroses of the skull, this just thick white sheet, and then also the aponeurosis of the abdomen as well. So these guys are made up of collagen fibers running parallel to each other, some elastic fibers, but the major cell that you'd expect to see in here are fibroblasts. And here we have another tendon. Here's the collagen fibers, and there's the fibroblast we mentioned, the primary cell you would see in there. Over here, we see some more dense, we need to talk about regular versus irregular. So regular connective tissue has the very organized pattern that you would see with the tendon. But like the dermis, for example, which is the second layer of the skin has 3 layers going from superficial to deep. We have the epidermis at the very top, the most superficial, Then in the middle, you have the dermis, and then the deepest layer that you're going to have is the hypodermis, which is predominantly fat. But you will find a lot of this dense, irregular connective tissue in the dermis. And irregular because you see it has this very random, swirly pattern. Dense, regular connective tissue is very, very organized. So we've gone through dense versus loose, and now we're breaking dense down into an irregular category and an irregular category. Oh, let's go into a bigger, higher magnification. There we go. We'll go all the way up to 400. There's the fibroblast again. Here are the collagen fibers. This swirly pattern here, that means that we're looking at, it's an irregular connective tissue. Here's elastic connective tissue. Elastic connective tissue, most of the slides I see kind of stay in this color, so this is actually a pretty common dye pattern, but with the elastic, it has this wavy, almost kinky, coily pattern to it. That's telltale for elastic tissue, elastic connective tissue. And this one here is shown in the aorta, and this falls into the dense connective tissue family, okay? And other places you'd expect to find these, we mentioned the aorta, other large arteries would have this as well, and the walls of the bronchial tubes as well, you would expect to find these fibers. But this falls in the dense connective tissue family. So see here, the elastic fibers, you see how they're very, very tightly packed together. We'll go a little bit higher in magnification. There are elastic fibers. And as the name suggests, there is some pliability to this as well. All right, so here's hyaline cartilage. Hyaline cartilage. And this is the trachea. So you can see here how it's bending, going around. It's making the C-shaped rings of the trachea. The trachea has C-shaped rings, not O-shaped rings. If it was O-shaped, then that hard cartilage would put a lot of pressure on the esophagus. The esophagus is posterior to the trachea. The trachea is anterior to the esophagus. So you have C-shaped rings with a much softer, like connective tissue, a much softer tissue back to it, so that it's not putting too much pressure on the esophagus, so that when you swallow, it's not hitting the resistance of the trachea. So back to our hyaline cartilage. The hyaline cartilage is this area here in the middle. This is 40 times magnification. So we're going to zoom in. This is in the trachea, but you would also expect to find this costal cartilage of the ribs. Looking at the ribs, the anterior portion of the ribs is made up of cartilage to add to the flexibility. Also, the embryonic skeleton, you would also expect that to have a high amount of hyaline cartilage, and then that cartilage eventually gets replaced with osseous tissue. Where else would you find this? The nose and larynx. So let's zoom in, see what we're looking at here. This is a telltale sign of hyaline cartilage. These little lakes, lacuna means lake, And the site, the cell, the chondrocyte, site means cell, chondro relates to cartilage. This is a mature cartilage cell. If it was a chondroblast, that would be an immature chondrocyte, an immature cartilaginous cell. So the cell is actually floating in this lake. That dark dot there is the actual cell, and then the cell floats in this lake. We'll go even higher in magnification. This is probably what most of you see in your textbooks. So here, it looks almost like a little eyeball. And this fluid around the lacuna and chondrocyte is called the matrix. There's more hyaline cartilage. Here, this is at 400 times magnification. But yeah, this is that telltale sign of the chondrocyte floating in the lacuna and then the lacuna floating in the matrix. More of hyaline cartilage, more of the hyaline. And then here, this is fibrocartilage. Fibrocartilage, one of the telltale places you will find this is in the pubic symphysis. The pubic symphysis, if you look in the pelvic girdle, right between where the two sides of the pelvic girdle meet, so right by the pubis and the ischium, there's this thin sliver of cartilage, that's fibrocartilage, and it gives flexibility to the pelvic girdle, which is very important, especially for childbirth. You will also see the chondrocytes in the lacuna, but you'll notice they're more tightly packed together, and there's a lot less matrix that's visible. So this is not as pliable as the hyaline cartilage, and definitely not as pliable as the elastic cartilage. Fibrocartilage is not just found in the pubic symphysis, you also find this in the intervertebral discs. In between your vertebral bones, and you also have a disc in the knee that have this fibrocartilage as well. So the fibrocartilage is a little bit tougher, but it's not completely immovable. It gives a limited range of flexibility. Here's the fibrocartilage again. Notice again that these excuse me, that these chondrocytes and lacuna are much tightly packed together. And here's more fibrocartilage. Here, this is the intervertebral disc. And here's elastic cartilage. Let's go up in magnification so we can really look at that. And this is in the epiglottis. So the epiglottis is going to be that flap that is in the pharynx, in the throat, that basically when you're drinking and breathing, you don't want to have the fluid that you're drinking or the food that you're eating go into the trachea, the windpipe. So this flap, this epiglottis, is able to slam shut over the trachea when you swallow, to ensure that when you swallow, the food or fluid doesn't go down the wrong pipe, quote unquote. But that is made up of elastic cartilage, so which makes sense. We want it to have some flexibility, but not too flexible where it's going to be, bending and not able to do its job properly. So it's able to basically open and close, so that as you swallow, you're not getting fluids and food in the lungs. This is more of the epiglottis. There's that lacuna with the chondrocyte, that dot inside of it. This is bone. So bone, bone tissue, quote unquote, also called osseous tissue. This concentric ring pattern is a telltale sign that you're looking at bone, especially compact bone. If you were looking at spongy bone, it would be a much different pattern. It looks like a sponge under the microscope as well. It's very porous. So let's talk about what we're looking at. You have this central canal, also called the Haversian canal, which is why this osteon, this unit, is called the Haversian system. So you have these concentric rings, and this dark pattern too is the fixing process of the slide. It's the bone dust that collects, so you kind of get this darkness. And also because these are holes, so you have bone dust that collects in these holes, and during the fixing process, they start to look black. But this bigger hole here I want us to focus on is where you're going to have blood vessels and nerves going through. Bone, that's why I said connective tissue is mostly avascular. bone is not avascular. Bone has a blood supply. Bone also has a nerve supply. So when you break bone, it hurts. And also when you break bone, bone is able to repair itself because of that blood supply. So again, this whole unit is called the osteon, or the Haversian system. This hole here, quote unquote, is the central canal, also called the Haversian canal. And you have these concentric rings that give bone its very organized appearance. And again, this is compact bone. This is not spongy bone. This is a much better view of it. There's that unit again, the osteon, and there's your Haversian canal or central canal, and you have these lacuna as well. And it's just giving more of a passageway too for the blood supply and nerves to pass through the bone.